Good afternoon. My name is Mona Locke, and I'm the Chief Communications Officer at Swedish. Thank you for joining us today. We would love this to be an interactive conversation, so please feel free to chat in your questions live during our conversation, and we'll try and get to them as soon as possible. Today, we'd like to take some time to share some insights into and takeaways on what you need to know about COVID and the flu season coming up. Joining me are two Swedish doctors, Dr. John Pauk and Dr. Paul. And Dr. Pauk, can you take a minute and give us a little background?
Yeah, so my name is John Pauk. I'm an infectious disease doctor, and I'm the medical director for infection prevention, infectious disease at Swedish Medical Center.
Dr. Upal?
Yeah, I'm Anita Upal. I'm an internist by training, and I do essentially outpatient primary care at the Swedish Ravenna clinic site.
Yeah, so again, thank you for both being with us. Dr. Pauk, let's start with you. Really, will you share a bit about the current state of COVID-19 and think we'll see a resurgence?
Yeah, hi, Mona. I think, unfortunately, that there are early signs now that we're starting to see a surge that we've been concerned may happen during the cold weather. In the month of October, we've seen a steady increase in the number of cases throughout the United States and including in the Washington region. So some of this increase may be due to increased testing, but certainly some of it is due to a real increase in the number of cases in the communities. And this is reflected by starting to see increased number of hospitalizations and deaths as well. So we're seeing a real trend there. And the concern that is, during the cold weather, that as people start to gather more, we have social gatherings indoors and less well-ventilated settings, that we may start to see more exposures occurring. And also the concern that people may be letting their guard down a little bit and not taking as many sort of safe precautions as they had been previously. So I think that we are starting to see that trend, and there is real concern that the coming months could be very difficult, for both increased strain on the hospital system and as well as the number of people affected by coronavirus.
Well, we've seen a lot of people socializing and outside, right? So you're saying as the fall, winter comes, we'll be going inside. Is that a little more dangerous even?
Yeah, so I think that the biggest risk is in kind of enclosed spaces that are not well ventilated, when we have people who are not distancing, especially when we're seeing people outside of their family groups who are starting to get together in those types of settings. And, with the holidays and with the weather and other changes that we may see, that may be a big driver of things worsening. And also in general, in cold weather with dry, colder air and dry conditions, that there are some biological reasons why the virus may be easily spread or transmit from person to person as well, on top of the decreased distancing.
So, Dr. Upal, how does the flu factor into this? I mean, we've tried to get out the information, get your flu shot. Why is that important?
Well, we are coming into flu season, which is a pretty typical thing, but unfortunately now we do have all of this coming up in the face of the current pandemic. And as Dr. Pauk mentioned, we're also coming into a time where people generally have been, really good following measures, being out of doors, but we're also coming to this time where there might be a bit more closer contact. People are again moving indoors. And these are situations also where influenza can spread.
So who exactly should be getting their flu shots? I mean, are there priority people? And what about kids?
Yeah, I recommend everybody touch base with their doctor, and for parents, reach out to your pediatricians. Generally, we do recommend that everybody get flu shots. For sure, for all adults, there are some higher risk populations, people with underlying conditions, diabetes, people over 65, definitely a high risk group. Women who are going to be pregnant during flu season, really encourage flu shots there as well.
What about if I'm staying at home because of COVID? I really don't go out much. I really don't have much interaction with the public. Do I still really need that flu shot?
Yeah, I would really recommend getting it. There's still the potential for when one's out and around doing your essential activities, you could be in contact, you could be exposed. So there is still that risk of influenza. And the other thing is we really want to do our best keeping everybody healthy this season. Again, Dr. Pak brought up a really good point. We're coming into this already with a number of people sick with coronavirus, and we don't want to strain the healthcare system too much. People can get really sick with influenza, and we really want to try to keep people healthy. It avoids any confusion, what are people sick with? And it results in increased medical visits, exposure of healthcare personnel, and then the potential if someone does get really sick, there's that issue of our capacity with the hospitals coming up this season.
Yeah.
And kind of, I'm sorry, Dr. Pauk.
Well, I was just going to agree totally with Anita said that, the symptoms of the flu and COVID are pretty much indistinguishable. So if you imagine if we have our normal flu activity, that's going to be a huge number of extra people are going to need to be evaluated, tested for COVID, potentially isolating themselves. And it's going to be a huge strain, not on only the healthcare system, but also on individuals and how they navigate their work, their other lives, their routines, if they're trying to separate out whether they have a flu or cold versus COVID. And we always have to assume, since they're indistinguishable, that it could be the more serious scenario. And not to downplay the significance of the flu every year in terms of the amount of illnesses, days of work loss, the hospitalizations and deaths that occur from it. But I think one thing I think is interesting to mention is that I think a lot of people are thinking maybe we're not going to have a bad flu year because we're taking all these precautions for COVID. What they saw in Australia is that they saw just a handful of their normal flu cases in the southern hemisphere, where they have their flu season in the summer, our summer. But I think it's really likely that we may see a very different picture here because, we're back at that time, they were under a very serious lockdown and very strict precautions. And what we're seeing is that we right now have not been as successful as having those strict precautions of physical distancing, avoiding contact, mask wearing. And we're also starting to see the COVID rates go up. It's an indication that we don't have this tight control over a lot of these things. We may very well indeed see more something more like our normal flu activity. And so we shouldn't count on it not being a big factor this year.
Again, kind of touching base on the fact that you guys are talking about the COVID and the flu symptoms being similar. What do I do if I get symptoms like cough, fever, things like that? Do I get tested for COVID? Do I assume it's the flu? What do I do?
Yeah,
good question. Oh, go ahead, John, and I'll jump in.
Well, I think the recommendation is that anybody with symptoms that are consistent with COVID should be tested for COVID, regardless of what they think about whether it's the flu or not. And we have a lot of people assume they have a cold and get tested, and it ends up being COVID. So the symptoms may not be that clear or striking or obvious, but if you have those symptoms that are on the list are potentially consistent with COVID, we want to test people. We want to know who is at risk, who has it, so we can take the right public health measures to kind of prevent transmission. And I think that also means if anybody is sick at all with any potential symptoms, in addition to getting tested, they need to stay at home and sort of isolate themselves until it's clear what's going on, and not make assumptions or guesses about what the cause of the symptoms are.
That's a good point. Again, what are the recommendations? You said stay home. Is there a self-quarantine time? What else should they be doing to keep themselves and others safe?
Well, assuming that someone might potentially have COVID, then there is at least a 10-day period of isolation at home, and even within the household, trying to separate yourself out as best you can from household members, doing good hand hygiene, good covering your cough, and really staying in different parts of the room and avoiding contact from other household members, but certainly not going out into public during a time that you're experiencing illness, or, especially if you haven't been tested, don't know what's going on clinically, assuming it's COVID, and waiting for that full 10-day period and your symptoms have clinically improved before you return more into public.
Is it possible to get, do we know if it's possible to get both flu and COVID at the same time?
Yeah, so it is possible. There are definitely studies showing that when people have tested positive for COVID, that there's been other respiratory viruses present at the same time in a number of cases. So they can overlap and occur at the same time. So that complicates things as well. So just testing, knowing you have the flu, doesn't mean you couldn't also have COVID, or as well. So that's why it comes back to the importance of testing everybody with symptoms or exposures for COVID.
So when in doubt, test. And Dr. Upal, let me ask you,
Sure.
how safe is it to go into the clinics to get your flu shot or to get the COVID testing?
Well, good question. So if you're sick with symptoms, we want you to reach out to your doctor so that you can get directed to the appropriate place to get COVID testing and any follow-up that's needed for that. In terms of coming into the clinics, we do have sites. For example, if we suspect COVID and we'd like someone to get tested, we'll do a triage and someone would be directed to go there. In terms of the other our regular clinics and things like vaccinations, we're taking all precautions. And like I said, triaging anybody with symptoms to be seen at our special sites for that. And we really would encourage people to come in or make that flu shot appointment. We are doing those routinely in the regular clinics.
Wonderful. A reminder for folks who are watching, please feel free to chat in any questions you may have. You have your experts at your hand, so we can answer anything that you may want to ask. Let's talk about the holidays. Holidays are coming up. Travel, is it recommended? Gathering recommended?
I think keeping up with whatever's recommended locally, whatever restrictions or guidelines there are, following those, but generally really wanting to minimize our contact with people and movement as much as possible. Just trying to keep things under control and trying to keep our curve, flattened.
We talk a lot about the bubble, right? Like your bubble of friends, associates, or people that you're around. Dr. Pock, would you have any recommendations around the travel or additional thoughts?
Yeah, I mean, I think the time on the airplane is probably not high risk given the ventilation systems and the precautions they take, but the process of getting to the traveling, being in lines and crowded conditions has some risk. But I think it's really about where are you going? What are you going to do when you're there? And typically, if you're traveling to be in larger gatherings or being around more close contact with people who are not part of your normal household, then there's going to be a significant increase in risk. So I think that's really important for people to really try to focus more on essential travel, and when they travel, not to drop down on the precautions of really trying to avoid close contact with people not in your household group, to wear a mask at all times when you're out in public, and to do careful hand washing, hand hygiene. But really to, I think about, are you going to be able to maintain the same precautions that you're taking care of now in those regards when you travel, and based on what your goals of your travel are.
Yeah, and especially who you're going to be around. So I'm assuming the high risk are the elderly and children?
Right. So people with concomitant medical conditions or the elderly or people at risk, I think that we really want to be thoughtful if you're going to be about how your travel, your family and social plans may impact those vulnerable populations.
Okay, well, let's talk about vaccines. We have the flu vaccine. What about COVID? Anything on the horizon? You hear a lot in the news every day.
Yeah, so right now there are a number of COVID vaccines are under clinical trials, what we call phase 3. So the first phase of study of vaccines is looking at their initial safety in a smaller population of test subjects, as well as their immunogenicity. How well do our lab tests indicate that they give us immunity? But the real test of vaccine to determine whether it's truly safe or effective is a larger phase 3 trial where we actually do randomized control studies in larger populations and see if it prevents infections and if it's safe in a larger population tested. So right now, there are a number of these phase 3 trials going on in the United States and other settings. And that data is expected to start coming back over the next few weeks to a couple months, and to be available for the FDA and other scientists to start to review the evidence about safety and effectiveness. So I think that we can expect pretty soon that there's going to be some of that data for people to start be aware of and start to make decisions, particularly on the FDA for our country, to decide whether they're going to approve any emergency use of these vaccines in the near future. I think probably we're looking at the end of the year or early next year at the most likely target for when the soonest those might be available for rolling out. However, I think that's important for people to know that even when the vaccine starts to be rolled out, they're going to be very limited in quantities at the onset. So it's going to take a while for there's a large amount available for a bigger population, which means that there's going to be prioritization of any early vaccine that's available to some of the higher risk categories. So all the states are required to develop a plan for how they'll deliver and prioritize the use of the vaccine. And that vaccine will be prioritized to likely high risk populations like frontline healthcare workers, to people with the elderly or a lot of other medical conditions put them at higher risk. And then trying to look at what are the high risk populations in terms of essential workers or other sort of groups, racial or worker groups that are at more higher risk and kind of taking equity and other issues into distribution for these more vulnerable populations. So I think that there's a lot of these plans are being put in place and the framework is there, but the actual details about the vaccines, how well they work and their safety, we still don't have that information yet to start to do the analysis.
What about treatments?
So treatments, there are a variety of treatments that are used primarily at this point for hospitalized patients. These include antiviral remdesivir, which just had a formal FDA approval, and it's now going to be more widely available, which suggests it may, for people who are hospitalized, may, in a subgroup of them, may shorten the duration of their hospitalization, improve, or kind of hasten the improvement of their symptoms. Although it's certainly not something that has a huge effect on the mortality or morbidity, as far as in the studies show. The use of steroids for people with more severe infection that are requiring oxygen support seems to have a significant improvement in people's outcomes. And so we do have some of these tools that are sort of, there's clear evidence supporting their use. So that's helpful. And I think overall the management of patients who are hospitalized with COVID has really improved a lot since the beginning of the epidemic. At this point, however, all the treatments for outpatients are really still under sort of the investigational stage and still not a lot to offer people who don't require hospitalization at the moment.
Thank you. And I think we saw a question pop up there about Halloween. How can we let our kids celebrate while keeping them safe?
Right. So I think the CDC has actually offered some nice guidance on this that I think I would encourage people to look at, and it kind of breaks things into what would be higher risk Halloween-related activities and what are more moderate and what are kind of low risk. And I think that there are going to be communities and people making some decisions based on what sort of risks that they would want to consider, for their children and families. But I think the predominant things is that anything that's going to be done needs to follow the basic sort of principles, no close contact with, people outside your household, the 6 feet of physical distancing, to make sure people are wearing masks, and that should be effective masks when they're out in public, the good hand washing and hand hygiene. I think obviously with candy that, a tendency that anything that should not be handled by a lot of people should be individually wrapped and made sure that it's done in a very, a protective sort of clean, way to prevent contamination if that's going to be given out, and not to violate those principles of distance and masking and avoiding contamination of anything that's being shared. So I think that there's some guidelines on this and how people can consider implementing different levels of precautions and still have a chance to celebrate Halloween.
Yeah, I think it's safe to say no big Halloween parties for sure. And I think people are coming up with very creative ways where, maybe it's trick or treat room by room in your house, right, for your kids, or if you don't feel comfortable going out. And I should probably also mention, if you don't want to entertain trick or treaters, turn off the porch light. Any last comments that you guys have about flu and COVID for people out there to think about?
I think one of the big ones would be just reach out, make a plan, get your flu shot, get your family vaccinated also. We really want to keep everybody healthy this season.
Hawk, any last words?
I think that I would just say that as we enter this time of possible surge, and I know we're all tired of what we've gone through the past 6 to 7 months, that we really need to make sure that we don't let up on really sticking to our basic measures we're taking to protect ourselves and our families, and just to really, just to kind of keep in mind that how much that pays off in terms of letting us start to return more to our normal lives and to get back to our, with our work up and running. And all these precautions we take can be burdensome. But on the other hand, that's what's going to help us return more towards normal and help to beat this epidemic. So that people really need to not let up on those things, even though it's been going on for a while now.
I think that's great because we all are having fatigue, right? And there's just such temptation to get out and see your friends and socialize. So thank you so much, Dr. Pauk, for those words of distance, masking, wash your hands, safe hygiene. Dr. Upal, get your flu shot. And I'm going to keep my fingers crossed that there is a vaccine that comes soon for COVID. Thanks to both of you for joining us today. And thanks to all of you for watching. Have a nice day.
Thank you.
Thank you.